Hello, everyone, and welcome back to another episode of the show. Obviously, the cabinet shuffle took place nearly a month ago now, and joining me today is one of the ministers who changed portfolios at that time, Philomena Tassi, who changed from labor to public services and procurement, and she's joining me today to discuss some of the vaccine efforts and how we can ensure that there's enough vaccines for booster shots or people who have yet to get their vaccines. So, Minister, thank you so much for joining me. I suppose a good place to start out is Ontario's top doctor, Dr. Kieran Moore, says that he expects that children ages 5 to 11 will be receiving their first COVID-19 vaccines by the end of November. Obviously, that's pending approval by Health Canada. But I'm just wondering if that were to happen, if children ages 5 to 11 were to be able to receive their vaccines, would Canada have enough vaccines to ensure that that can happen by the end of November?
So the short answer to your question, Wyatt, is yes, we've been working on this in anticipation of the possibility of Health Canada approving the pediatric vaccines. So you may have heard my predecessor, Minister Anita Anand, say that we do have an agreement with Pfizer for 2.9 million doses of pediatric vaccines. That's enough doses to vaccinate every eligible child 5 to 11 in Canada. And we've worked with Pfizer so that once the approval comes forward, because we know we need that approval first before we move forward, that they will expedite these doses so that we get them in a very timely fashion. And I have had a phone call with Pfizer, and ensuring that we are on target for that. And that assurance is there.
And more specifically, if we look at booster shots, obviously, you said the short answer to the question would be yes, the answer to my last question. But as a new question in regards to booster shots, we've seen that some Canadians are already receiving their booster shots, those in, let's say, the medical field or some in other fields as well. But let's say, Health Canada or Health Canada were to say that it is best that Canadians receive even let's say a third vaccine, like a booster shot, or whatever the recommendation by Health Canada is. Would there be enough vaccines, for example, to ensure that every Canadian could have a third dose of the vaccine, and how long would it take?
Yes, our government has been very clear from the beginning of this pandemic, and as we've worked through to say, listen, the vaccine is the best way to combat COVID-19. And so on the procurement front, we did that when we entered into agreements with our 7 suppliers. We ensured that we would have enough vaccines, and there'd be the flexibility that they would be boosters. They could move to pediatric vaccines if, in fact, approval was received. And so, again, the short answer to your question is yes. And of course, we want to encourage all Canadians to step forward and to get the vaccines, but also to get the boosters. And as we move forward, to ensure that once we get the pediatric approval, that we move forward in that front as well.
And you mentioned a little bit about just the idea of vaccines. I think even let's refer back to even the last federal election campaign. There were lots of people following around various leaders for not believing because they didn't believe in vaccines. So maybe speak on that point. Obviously, the majority of this is kind of this wouldn't necessarily fall under a ministry. It would kind of just be a generic idea of ensuring that vaccines are safe. But maybe speak a little bit about how your ministry and what your ministry can do to help to ensure that the vaccines that Canada is procuring can be assured to Canadians that they are safe.
So I think here, it's very clear that our government has followed the evidence and the science. And so that's why when Health Canada makes these approvals, they need to take the time to ensure that the advice that they are given is advice that is going to keep Canadians healthy and safe. And so we don't, even though we're anxious for these vaccines, including the pediatric vaccine, it's really important that the time is taken so that those that are looking at the evidence and the science can be telling us that these are safe. And so to date, we have had Health Canada approving vaccines that are safe And I want to take a moment to thank all those across the country that have really taken the time to ensure that all those doses that we secured got to the places that they needed to get. And that was really heroic on behalf of Canadians, right? And I'm speaking about those that are driving the doses, to those that are giving the immunizations, to those that are scheduling the appointments. Really an all hands on approach. But at the end of the day, it's the evidence that has determined that these vaccines are safe, and this is the best way for us to combat COVID-19.
And obviously, from originally, I think it was vaccines weren't going to be ready for Canadians to receive up until September of 2021. And then the government made it happen far quicker than that. So what lessons can we learn for future pandemics in the future, or even current campaigns, like let's say the flu shot, for example, just to make sure that, like what lessons can we take from the way Canada procured vaccines for COVID and attach those lessons to future pandemics?
So I think that it's always about preparation, right? And looking ahead. And that's what we've done. Like if you look at the agreements that we have made, you asked me the earlier question, we've entered into agreements with the 7 suppliers looking ahead. So for Pfizer, for example, we have 35 million doses in 2022, 30 million doses in 2023. Moderna, we have 20 million in 2022, 20 million in 2023. So part of it is just looking ahead to ensure that we have the doses that are required moving forward for this eventuality. The second thing I would say on this, and it was in one of the conversations I had with the suppliers, they said, what made Canada impressive was how ready Canada was in terms of delivering and ensuring that the shots got into the arms. And this gets back to my previous comment. Like this takes an army, right? This is thousands of people across this country that really did heroic work in order to ensure that Canada was ready. And us being ready helped us secure these vaccines, which is so important because we know that the competition was so strong, right? Everybody wanted the vaccines. And we're talking about vaccines that weren't even put together then, right? That Health Canada haven't approved, that they were running trials on. So I think the lesson moving forward is to ensure that we work collaboratively, and I'm very pleased to have worked collaboratively with provinces and territories on this, but then also all Canadians stepping up because we have to be ready. And that's, I think, the key to success moving forward.
And just as one final question, just what's your final message to Canadians? I think is a good way to end it off. What's your final message to Canadians who have not yet gotten vaccinated, and maybe even kind of interlink it with the way that you've been able to procure vaccines and how you plan to continue to ensure that Canada can have good vaccine procurement?
So I think at the end of the day, what I would say, Wyatt, is that the evidence, the science demonstrates that the way for us to get through this pandemic is through vaccination. And that's the way that we're, going to get to the other side. And so that's what the evidence and science demonstrates. We are embracing that. We know that if you are immunized, you are in a much better place in terms of COVID-19 and contracting it. And so I want to encourage all Canadians. And listen, I understand that there are concerns, but speak to the medical experts, get that advice so that you, and now in the future, hopefully very shortly, can bring your children to get vaccinated, because that's the way that we are going to get through this. It's the safest way to progress through this pandemic. And finally, just want to thank so many Canadians that have worked so hard to ensure a smooth immunization process.
All right, Minister. Well, that was my last question. So thank you for joining me, and it's been great talking with you, and thank you again.
Thank you, Wyatt. It's been wonderful speaking with you.